Yes, it's working.
Okay. Heidi.
Ayman, you are mute.
At the beginning. Good morning.
Morning.
I'm a PTA student and I have here.
Hi, I'm Nubia. Nice to meet you.
Hi, my name is Ray.
Hi, my name is Zhongqi.
Good morning.
Good morning. First of all, I just need your consent to be recorded. All what you say, you just say yes, or I give you permission to record.
I give you permission.
Oh, thank you so much. First of all, may I know what's your name and your age?
Oh boy. Ralph Mitchell. I'm 72 years old.
Oh, nice to meet you. Can you give us a little bit an intro about yourself, who you are and what you do?
Are we talking as a patient or outside of the patient norm?
As a patient.
Well, as you read my evaluation, so you know I'm having some problems with ambulation. And I'm presently using a walker for balance.
Okay, so tell me a little bit about your ambulation or total knee replacement. Like, do you have a problem standing or sitting or something like that?
Pain. My knee is in pain. Yeah, and that prohibits me from really doing anything at the moment.
Okay, so can you describe the pain? So from scale 0 to 10, can you describe the pain?
Sometimes it's 11.
Oh.
Sometimes it's 6.
Okay, so when it's going between 6 and when sometimes going to be 11?
You know, it depends on, what I'm doing. I try not to ambulate a lot. And I have problems because there's stairs and it's very problematic. So I'm homebound. I don't go out. I don't do anything. And the pain, exacerbates predicated on the environment.
All right, I understand.
Let me ask you something. When was this surgery? How long was it?
6 weeks ago, 6, 8 weeks.
Okay, and you still feel pain and some difficulty to walk and
Yeah.
yeah. It's like your daily activities it's difficult. Yeah,
there's no day activities. So hopefully the therapist, you, I would imagine you have my history.
Yes. I'm seeing here that you have some significant history in your knee, right?
Yes.
And other injuries or other surgeries?
Just whatever you have on my my notes.
Yeah, your left knee is better than the right knee, right?
That's true.
Basic situation, okay.
Yes.
So do you take any medication for the pain?
I take medication prescribed by the doctor and unprescribed medication.
Does that help you to relieve the pain, especially when you say it's like 11?
Yes.
It's extremely painful.
Yes.
Yeah. Okay, so
but I don't want to become an addict with the medication.
Sure.
Right.
So,
does that has any side effects? Side effects to maybe affect your sleep?
What, the pain or the medication?
Yeah, the pain.
Yes. And so the tendency is to take more, which I do not want to do as far as medication.
Okay.
Okay, so how about the numbness and tingling? Do you have any numbness or tingling in your knees?
No, just pain.
Just only pain?
Yeah.
So, Mr. Ralph.
Yes.
So I'm just curious, do you need any help when you carry out the daily life task, like such as like transfer from bed to chair stuff?
Well, depending upon what kind of assistance that you and a social worker are going to give me, wink, wink. Sometimes all I can do is just sit at the edge of the bed because the pain is so bad. And then other days I'm able to stand with the walker, but just short distance walking to the
okay.
bathroom and back.
So I saw your chart.
Thank you.
Yeah, no
Good.
problem.
Good. See?
Yeah, actually, I saw your chart. You are living with your wife, right?
Yes.
Okay, so is your wife always able to help you around, or
No,
does she? Oh,
because she goes out.
oh, I got you. Okay, so especially like when you walk out of the building, you said you need to take like 6 steps to enter the lobby, right?
Yes.
So how do you feel about that? Any like a body feeling?
Well, again, you know, if I'm taking the medication,
Yeah.
it helps a little bit. So I try to program my activities around how I'm feeling that moment.
Okay.
So it's day by day.
Your wife is able to take you to the physical therapy, right?
Yes. But at least getting a cab.
Okay,
Okay.
good.
Okay, so
Oh, yeah, go ahead, Amy.
have you noticed anything about changing your health after,
The surgery.
like after the surgery?
I'm depressed. Very depressed.
Sorry about that.
Why?
Because we are here to help you. So as a PTA, so maybe we can share, you can share whatever you are feeling just to release your depression.
Okay. Just a minor criticism. Always have your chart in front of you when you're talking to the patients, because the questions that you were asking me, they're in the chart. So, you know, you don't want to be redundant.
All right.
Because that will piss the patient off if you don't know what, you know, the questions.
Thank you for your advice.
Oh, please. It's a learning process.
Yeah, for sure. It's our first.
Well, good luck.
Thank you.
So one more question, Mr.
Sure, please. Any questions?
Yeah. So like right now you are taking some like a rehab exercise, right?
Minimal.
Minimal. Like what kind of exercise?
Well, it depends on who's treating me at that moment. I can't do aggressive range of motion or anything.
Oh,
So everything is very minimal range of motion exercises.
but do you feel comfortable about this exercise right now?
No.
No?
You still feel pain,
Pain?
right?
Yes.
You think
Okay.
feel difficult for that.
Because with the pain, I don't want to do anything. Because, you know, why? So it's your job to make me feel better.
Yeah, for sure.
Oh, yeah, for sure. Oh, boy, I love these answers.
Yeah. So tell me more about what are your goals from therapy? You want to be able to do whatever you are doing before, right?
I like to be pain-free right now. That's the goal.
Before the surgery, you were working? No, you were lab tech, retired, right?
Yes.
Okay.
At the same institution that you're going to school now at.
Okay. Is there anything you need to add or we should know about your current health and your daily activities so we can add to our treatment? to help you?
I think that, you know, your staff has asked, you know, the pertinent questions. So, I'm taking it one day at a time because I can't think straight when I'm in pain. So I don't really have a clear long-term goal other than getting rid of this pain.
So do you mean that you take the pain relief medication every day?
Yes.
Okay. So do you think like talk about this situation with your primary doctor about this? Because maybe too much this pain relief medication maybe also will cause others like side effects.
Like what?
Like because some pain medication were not good for the stomach or something like that.
Mhm. Well, I get,
But it's
next time I see the doctor, and hopefully the PTA and the doctor will get together and compare notes so we're all on the
Mhm.
same page, because this pain is really limiting any type of activities.
right. Usually it's medication and with physical therapy, that's exercise will help a little bit. So if too much medication also not that good, just my thinking. Yeah.
I'm sorry, what?
I mean the physical therapy treatment should also help the exercise.
Well, it helps if I'm not in pain.
Okay.
I have a very low pain threshold.
Mhm.
And I don't want to stay in bed all day plus all night because I can't stand. I have a fear of falling.
Mhm.
Yeah, you know, in general, after a surgery like yours, you can expect to be back in like 2 to 3 months before the normal, but everyone is different, right? So if you are in pain, you cannot participate in the therapy.
Yeah.
So yeah, it's before I think we should take care of this pain with something
Hmm.
less what can I say, minimal exercise to
Relieve that pain.
yeah, relieve this pain. Thank you, Emma. To relieve this pain, and we after that we can work and put you back in life.
I hope so.
Yeah. Yeah, okay, I think you will have all the informations here, and let me summarize everything you said to us.
Hmm.
And okay, we know now that you have pain in your knee and you cannot do anything.
Anything.
Yeah, anything. Yeah, even minimal exercise getting you to be in pain. So I think our first do here is relieve your pain,
Right.
and hope so you can back your life in like
Okay.
2 or 3 months.
That sounds good.
Mhm. Okay.
So we will definitely to communicate with PT with your progress, you know, the stuff to try to like figure out the best way.
Good
to-
idea.
Yeah.
Good.
That's the plan for, yeah.
Good.
Yes, we are getting all the information, and you have to discuss with your PT supervisor
Okay. That sounds like a plan.
to start your treatment.
Yes.
Thank you so much.
Thank you. Thank you
Thank
so
you for the
much
time.
information, yeah.
Very
for the
welcome.
information.
Thank you.
Thank you.
Thank
Have a
you.
good day.
Yeah,
Have a
right.
good day.
Be careful.
How am I going to have a good day?
Take care.
Thank you,
Thank
Mr. Mitchell.
I
Thank
hope
you,
so.
Miss Professor Tom.
Before you go, do you have any specific comments or anything?
Well, just what I had said initially, to the first gentleman that was, you know, you have the chart of my history.
Yes.
So you really don't have to go over. So, you know, what is if you know exactly what my problem is. So you move right into the middle lane of conversation, like all of you started doing. You know, nobody wants to be that guy to start asking questions first, you know. It's like a blind date syndrome. But if you got the chart, you just bounce off, because what I was noticing, the other classmates were taking mental notes from what you were saying in my reaction. And so they had, you know, the thought below, well, I'm not going to say that.
It's true,
So-
because I got the intro, so that's why it's getting a little bit harder.
So Nubia and Rude, they just hit, boom, the questions. And then, you know, the other classmate, you know, Wu, you know, it was easier for them. So what you did was, you know, first the blind date syndrome.
Yeah, it's so difficult to be the first one
Oh,
to start a conversation, right?
right. And many, you know, a lot of patients are very anxious, upset, and
Right.
pissed off.
Mm-hmm, mm-hmm.
So during the course of your semesters, you're going to learn how to deal with that, because sometimes the PT's not around. You're the one treating the patient,
Right.
and your patients